Hello, Mr. Miranda.
How you doing?
Hi, my name is Mehdi, and I will be your nurse today.
Okay.
How are you feeling?
All right.
Doing okay?
Okay, not too bad.
Do you know where you are?
Brandon Regional
Okay.
Hospital,
Do you know what day it is today?
July 10th, 2015.
Good. And would you happen to know who the president is?
Barack Hussein Obama.
Okay, very well. So before I start, I'm gonna go ahead and wash my hands and don some gloves. And I'm here today to do a head-to-toe assessment on you. Is that okay with you?
Mm-hmm.
Okay. So I will first start by checking your skin. Okay. Looking at your hair, visualizing your hair and general appearance of the skin. Very well. Very good, thank you. I will then palpate your skin. Check for skin turgor. Both hands. Very good. I want to check your temperature. Make sure you're not having a fever. Very good. I will then check your nails and nail beds and capillary refill. Very good. And check to see if there is any nail clubbing, which you do not have, which is a good thing. Very well. Thank you. I will then move on to the cardiac assessments. I will be pretty much checking your precordium by first visualizing your heart or cardiac area. Very good. I will then palpate and look for your apex. Feel for the apex and PMI. And we'll also check for any thrills, heaves, or lifts, which you don't seem to have. Very well. I will then auscultate. I will listen to your heart. S1 and S2 present. Very good. I will then check to see if there is any heart murmurs in the apical area, tricuspid area, pulmonic area, and aortic area. No murmurs detected. Very well. I will then move on to check in your respiratory area and do a respiratory assessment on you. I will first start by visualizing, making sure there is no abnormal elevations of the lungs or the chest. Very good. I will then percuss, make sure there is no masses. Very good. And then we'll palpate. Make sure there is, once again, any masses or abnormal elevations. I will then auscultate or listen to your lungs, starting by the right upper quadrant. Deep breaths for me. Again, in and out. Again. Checking the basis of the lung. Very well. Can I have you sit up for me? I would like to listen to your lung sounds on your back. Deep breaths on for me. Good. Again. Very well. Again. Very well. Lungs are clear bilaterally. Can I have a sit on the edge of the bed if you would? I would check for something called tactile primitus. Pretty much when you feel both of my hands touch your skin, I just would like you to say the word 99 every time you feel me touch your back.
99.
Good.
99.
Good. Again?
99.
Very well. The sounds are bilaterally equal, which is a good thing. Can I have you lay back down for me? Thank you very much. I will then do a vascular assessment on you, but first visualizing your carotid artery and check on both sides if there is any abnormal pulsation or elevation. Very good. I will then listen to your artery, to your carotid arteries. Can I have you turn off for me? Thank you. The other side. Very good. I will then check by hand the carotid arteries, making sure not to check both of them at the same time because you could actually pass out if I did that. Good. The other one. And I'm also visualizing the jugular veins on both sides. Very well. I will then check for pulses. I first check your brachial pulses. Bilaterally at the same time. And then your radial pulses. Very good. Pulse is regular and no bounding. I will then check your popliteal pulses. Very well. You can feel them. Then move on to the posterior tibial pulses. And finally, I will check your dorsalis pedis pulses. And again, I'm checking to see if there is any edema on your lower extremities, which you do not have. Last thing I will do with you is do an abdominal assessment. I will first start by visualizing your abdomen, making sure there is no lumps or masses or scars on your skin. Very well. I will then auscultate or listen to your abdomen, starting in the right upper quadrant. Bowel sounds are active. Move on to left upper quadrant, left lower quadrant, and then the right lower quadrant. Bowel sounds are present and active. Very well. I will then move on to the next step, which is percussion of the abdomen. Checking for any underlying issues or any masses. And I'm listening to tympanic sound, which is the normal sound to hear. Last thing, I will go ahead and do palpation. I will first start by light palpation. Any pain or tenderness in all four quadrants. I will then go a little deeper and palpate for the liver, any pain, and then move on to the left upper quadrant and palpate the spleen. I will palpate for the iliac arteries, and then renal arteries. Any tenderness? I'm sorry, I'm pressing a little too hard. And then finally, I'll be checking the abdominal aortic artery. Very well. Last thing I would like to do with you, Mr. Miranda, is to have you sit up for me, just like you did when we did the tactic fremitus. If you would, thank you. And then I would like to check for the costal vertebral angle. That's pretty much checking your kidneys to make sure they don't hurt. Any pain? How about on this side? No pain? That concludes our head to toe assessment. Thank you for watching and have a good one.